Good morning, everyone, and welcome. This webinar is brought to you by Strategies 2.0, a statewide collaborative funded by the California Office of Child Abuse Prevention. Today's call is implementing a strengths-based approach to practice. This call is scheduled from 10 to 11:30 a.m. I am Carrie Collins, today's facilitator, and my role today is to introduce the topic and the presenter, to keep track of time, and to help the presenter and participants in any way that they may need. In a moment, I will introduce the presenter to you, but first I'd like to go over a few webinar guidelines with you. So hopefully everyone can see my screen. The way that you open and hide your control panel is with this red arrow right here. So if you push on that, it will either open up your control panel, or if you push on it, it will close your control panel. You can join us today by either using the telephone, and if you click on telephone, it should give you a phone number to call in, as well as a code and a PIN. Or you can use your microphone and speakers if that works well on your computer. We're going to submit questions today via our chat box, which is now highlighted. So hopefully you can all see your chat box on your control panel. Just to kind of test it out today, why don't you type in for me, what was your favorite Thanksgiving food? Let's see if you can all hear me. And those of you who want to participate can type in your favorite Thanksgiving food. Oh, we have green bean casserole from Stephanie Morris. It's always a favorite. Ah, mashed potatoes. Good. Oh, macaroni and cheese. Okay, there's a lot of different things that people do for Thanksgiving. Cranberry sauce, grandma's orange jello salad. Always something good. Oh, the turkey. Good. So obviously you can all hear me and your chat box is working. We're going to use the chat box as a way for you to communicate with our speaker today. So if you have any questions or comments, we invite you to put those into the chat box. Chat box is being monitored today by my colleague Shane Meserve, and Kaya will take your questions at the end of her presentation today. Let's see, what else do we need to tell you about? So at this point, let me introduce our speaker to you. Kaya Okuniewski graduated from USC Sol Price School of Public Policy in 2015 with her master's in public administration. She joined the Children's Bureau of Southern California, which is the largest child abuse prevention nonprofit in the nation, in March of 2014. She currently serves as the lead for Children's Bureau Social Enterprise, the FAF software, a research-validated, comprehensive data management, assessment, and evaluation system used to help hardworking child welfare professionals and organizations better serve vulnerable children and their families. As FAF's lead, she oversees all core aspects of the program, including planning, training, and quality control. She has successfully integrated and implemented the tool with major clients, including Los Angeles Department of Children and Family Services, Family Preservation, and Partnership for Families programs, and New York City's Administration of Children's Services Family Care in-home program. Prior to Children's Bureau, Kaya worked at nonprofit finance funds, where her interest in the social enterprise sector manifested. I'm going to turn it over to Kaya at this time. So just a moment while we switch presenters, and then Kaya will take it from there. Welcome, Kaya.
Thank you, Carrie, for the introduction. But enough about me. Welcome and good morning, everyone. Before we dive into the agenda, I always like to get a sense of who I'm speaking to. So I was hoping everyone could kind of type in the chat, are you a caseworker, supervisor, executive director? And sorry, Carrie, one thing I didn't get a chance to, oh, I see. Huh, got it, I'm seeing everything. Program directors, caseworkers, wonderful. So sounds like we have a diverse group of folks in the room or on the chat. So the Child Welfare Agency administrators and policymakers are continually striving to improve services and outcomes for children. And the strengths-based model is just another critical one for helping make that happen. So today we're going to define strengths-based model and its benefits. We're going to identify strategies to implement a strengths-based model into an organization. We're also going to describe ways to apply family service in practice and how to address family concerns in service planning. And lastly, we're just going to identify a few case management and assessment tools that help integrate strengths-based model into daily routine. So just a little bit of history about the strengths-based model and traditional practices. Traditionally, they were focused on the deficit model, and the deficit model focuses on what's wrong with the family, which can really be punitive and stigmatizing. And studies have actually shown that this model increases passivity and resistance from clients. And knowing this, more and more organizations over the past decade, or really a couple of decades, have transitioned to the strengths-based model that we're going to talk a little bit more about today. And this, again, started happening during the early 1980s in mental health centers, but has been picked up over the course of the last couple of decades. So really, what is a strengths-based model? So before we actually jump into that, I think it might be helpful to identify what a strength is. So I'll give you all a chance to enter what your view of a strength is in the chat. One could kind of type in what they think a strength is. Don't be shy. Yeah, so knowledge, empathy. What else is a strength of someone? What's another example? Resiliency. Right, so it's a quality. Yeah, so strengths essentially are personal qualities, traits, or values that someone possesses. It can be something that people know about the world around them, perhaps some talents that they have, or also maybe a personal story or cultural story that may have turned into a strength, just for example. So we're getting some really great examples: ability to self-advocate, etc. And another opportunity for you to use the chat are explain some of your strengths. Each person in this chat already possesses strengths that will help incorporate a new perspective like the strengths-based model. It's important to be aware of your own strengths, especially in case management, because we'll be using those strengths throughout our work. So think about it. What are some of your strengths? Maybe take a moment again to share in the chat. We have folks that are well organized, great. Good communication. We have folks that are good listeners, all good traits to have in this child welfare sector. Working well under pressure. Great. So let's talk a little bit about what the strengths-based model is. So the strengths-based model, no surprise based on what we've learned about a strength and some of the strengths that folks have shared with us, refers to policies and practice methods and strategies that draw upon strengths of children, families, and their communities. And one thing that the strengths-based model does in particular is it acknowledges each child and family's unique set of strengths and challenges. And so by doing that, you're no longer fitting families into a pre-existing service plan. Rather, you're focusing on their strengths and building around their cultural backgrounds, etc. Talking more about definition, so the strengths-based model essentially is based on goal setting around these specific needs and strengths. And more importantly, it's about the client taking responsibility for identifying some of those goals and setting a path towards accomplishing those goals. And what that does is it helps those clients and those families feel like they're equal partners in the change process, which in turn helps reduce that resistance and helps the client invest in the goals because they're the ones setting them. And what that does for the caseworker and how that changes the caseworker's role is really that they're just giving feedback on the goals that the family has set for themselves, and they're more so advising, helping negotiate with the family about the types of things they should be focusing on. The casework will also now be focusing more on structuring their goals and really coaching them through the process and encouraging them to accomplish the goals they have set for themselves. So the strengths-based model, let's talk a little bit about the difference between what it was in the past and what it is today. So you're no longer acting as an expert. You're also not the one really creating the solution for the family. Rather, the client is really the expert of his or her own life or their family's life. And the practitioner is, again, there to facilitate the client in their solution building. And the solution also comes up without connection to the problem, right? It's more the connection to their strength and how they can address these problems. So the strength-based model has proven to have really 3 benefits, and these include influencing the extent of the client's engagement, increasing the family's efficacy and empowerment, and really increasing their parenting competency and their ability to perform parenting tasks successfully. And then it also helps enhance families' relationship building capacity and their social support networks, because this goal setting is happening with the entire family, and that helps the family learn how to listen and work together and how to communicate better with each other, which can then be taken into society. Other benefits in the strengths-based model, though not necessarily proven, can be that the model is more culturally neutral and less prone to practitioner bias because it addresses these individualized strengths of the family, which take into account culture, gender, age, and religious background, and even class. And then also a benefit is that it allows the child welfare professional to consider what's going on right with the family and learn more about what's right with the family, which oftentimes are a result of family resources that they already have. And then they can use fewer resources of the agency itself. And the reason why that's important is because agency may have time constraints with the family, so they can only work with the family for a certain amount of time if that program only allows a certain amount of time, or perhaps agency resources and services may be limited because of funding, etc. So it's also always great to really focus and draw upon strengths that already exist. All right, so moving on, how do we take the strengths-based model into practice? So we're always trying to develop our engagement skills to a high level, and it's an ongoing process that continues throughout our careers. And really, the strengths-based model, just like any kind of model, really starts with the caseworker and how they're engaging with the family. And the strengths-based model focuses, it's oftentimes more unstructured, and it requires that the caseworker really talks to the family and just gets to know them and doesn't really interview them at first, because you're trying to build that rapport and buy-in. So let's do another exercise. For those of you who have been or are currently in a committed relationship, what really told you that you were in that state of commitment or engagement? What was the outcome? What was the sign? You can add it in your little chat. All right, we have trust, mutual respect, communication, it's a verbal agreement of a partnership. Looks like some folks are saying that making significant decisions about the future is a sign that you're in a committed relationship. Great, so some of the signs that I have written here is maybe you met the family, that you're feeling more comfortable, that you just had a feeling, or maybe there was some sort of official proposal or acceptance. Now, it looks like some of you already touched on this, but what were the behaviors and interactions, qualities, and characteristics involved in the development of the relationship? So some of you had mentioned something like trust, compromise, communication. So those are some of the examples that I have here as well. Spending time together, right? Openness. Someone's saying openness. Great. And exactly. So engagement. So how do you do that? How do you get engagement? So you listen, like in a committed relationship, you're creating a relationship with your family. So you're listening to the family, you're being honest with the family, dependable. You're really tuning into yourself and others, and being open. And you're also allowing maybe the family to make mistakes and process and learn, much like a committed relationship. So one of my personal strengths is honesty. And so thinking back to some of the strengths that you all had mentioned, like organization, et cetera, how can you use those, your own strengths, to help with engaging the family and the challenges that you have with engaging the family? So I mentioned honesty is one of mine. So maybe one of the things I would do to help engage the family is inform the family about me noticing and recording their strengths, letting them know that I'm taking down notes. And what this does is it really helps the family understand that you're trying to help them, and they'll see you less of a threat. That's just one example. Another way to implement the strengths-based model is to frame questions in a different manner. So a deficit model question would be something like, when has this problem been at its worst? So can anybody in the chat give an example of how a question like this can be actually said in a solution-based manner, in a strengths-based model manner? And add in the chat. What's another way to frame this question? What have you tried that has worked to solve this solution? Great. That's one example we had. How have you solved this before? Exactly. So what I have here is, tell me about the times when this problem was a little better. So again, how did you solve this before? Not necessarily focusing on what was the worst time of the problem, right? Some other ways to engage a family could be by asking open-ended questions. So this is helpful because it offers the client the greatest latitude in responding to the questions asked. It also makes these questions seem more conversational and perhaps less interrogative. Another way to implement a strengths-based model in practice is by summarizing conversations that are being had. And what this ensures is that the caseworker is understanding what the family is saying, and also it can be a way of concluding one topic and starting the next. Another solution could be tolerating silence. So allow for reflection, and this also allows the family to really think through and provide more input on what's going on, because they can think about it and then explain. Another is to be to perhaps have less self-disclosure, because oftentimes it can be misunderstood, but still it can be thoughtful about your responses to, and it helps to be thoughtful to your responses to your client's questions. And then lastly, help the family to start considering a more positive future rather than focusing on the past. It's another way to engage folks using the strengths-based model. And I believe, and I'm sure that many of you have already been using the strengths-based approach in some degree over a career. So maybe in the chat, share what are some current strengths-based practices that you're using in the field. Anyone can share in the chat. Someone's saying reframing, great. Understanding. Building rapport, right? Giving multiple options and different resources, showing them empowerment, listening, right? So there's definitely a theme here with the strengths-based model. But like also, there are also challenges to the model. Some of the challenges that sectors found using this model is agency culture and characteristics of families can be difficult. There's also child welfare turnover. Also time constraints, which we alluded to earlier. And then sometimes there are a lack of services and access to services. And so we're going to talk a little bit about each of these and how we can help curb these challenges. And one of the ways of doing that is by implementing policy and best practices. So why do we do that? Well, first, because the strengths-based model may be implemented inconsistently and can be diminished over time if there's high staff turnover. And so we're going to talk a little bit about that again. But the first challenge is culture and characteristics. So some of the issues that are found with culture and characteristics is that some families really have severe threats to the child's safety. And what this can do is it becomes difficult for a caseworker if they see severe threats to be positive and pull upon some of the strengths of the family. And another is the majority of families involved with child protective services don't actually seek services voluntarily, right, and are less likely to be compliant, which leads to a difficulty in establishing an alliance. And some of the ways that you can solve this really are really about training. So, making sure that your staff members are trained. So there has to be some sort of focus on supervisors training their caseworkers, so train the trainer. Another solution is collaborating with other agencies. Other agencies may have different tips and tools that on maybe their strengths-based approaches and how they're using them. Another solution is the assessment tool. So there are assessment tools out there that can help create routine and help implement the strengths-based model into practice within an organization. And you'll see that that's a recurring theme throughout these challenges as a solution. Another one is staff turnover. So when it's high, it can cause low staff morale. Excessive workloads can also be a challenge. And feelings of, which all leads to feelings of rejection and insignificance by the family, which again will keep them from engaging with the caseworker. And some of the solutions around this are, like I mentioned earlier, kind of implementing assessment tools and keeping track of family progress. Another is ongoing staff training. Again, this is definitely some responsibility of the supervisor to be trained in different models and make sure that their caseworkers are also trained. Another challenge is time constraints. So some issues around this, again, it goes back to sizable caseloads can affect quality of interaction with the family. And another issue may require that meetings occur in the office versus a community setting, and this may be less inviting to the family and less welcoming to the family. And a few ways that you can solve this is by having a formalized structure. So, having caseworkers prioritize family meetings. Also, child welfare is now mandating time frames for this reason to help curb, again, the structure. Another challenge is lack of services and access to services. So some of the issues here, they are particular to the rural areas, and lack of services can pose a major challenge because at times in rural areas, and really even in urban areas, you may have one caseworker to 20 clients or one class per 20 participants. And some solutions around this are making sure that the caseworker knows about existing services, not only within the organization, but also outside of it, knowing the services at other organizations and being able to refer out. Another solution that the sector is working on really is creating child welfare positions that identify community services. So folks that are actually trained in referring people out to different organizations. So in summary, again, some of those solutions that you saw there, it's about consistent and ongoing training. It's necessary. Also, it's important for management and supervisory staff to focus on their workers and ensure that they are being properly trained. Another one is the importance of reassessing assessments itself. So looking at the assessments you have and making sure that they're the best fit for your program. Another thing that we talked about in terms of solution is that interagency collaboration and needing to elevate child welfare systems and resources. And while that's certainly out of some of our control, we can look out for some of those interagency collaborations. So we're going to focus a little bit on some of the strengths-based tools that can help with the strengths-based model. But we're only going to talk about a couple of these tools. And strengths-based tools are helpful because they help better match needs to services. And they also help structure intake tools and create, again, that habit and routine. And that infrastructure is needed to support case managers. And so two examples of strengths-based tools are the FAST and also social solutions. And there are plenty of others, and we'll talk about where you can find those. But in particular, the FAST software is a good tool for a strengths-based model because it's actually already incorporated in the assessment. It's an off-the-shelf product, and it's affordable, and it tracks clients' progress by, and you'll see in the next slide here. So if you look right here, it actually asks, how are you going to use a strength to apply to a concern? So the FAST has a scoring system. And the scoring system is on a 1 to 5 scale. And on a scale of 5, 4, and 3 are considered concerns, and scores of 2 and 1 are considered strengths. So you're looking at different domains, and you're scoring different domains like living conditions, financial conditions, interaction between child and caregiver. And when scoring, the positive scores, the strengths, are applied to the concerns. And so it's a template like you see here. How will you use the strengths to apply to these concerns? And it also helps, again, to make sure that there's consistency over time on how these service plans are completed. And then it spits out a template here, and it has the strengths at the top and the concerns at the bottom. Another tool is the social solutions tool. And so social solutions can incorporate the strengths-based model. And the social solutions, they do it a little differently. So it's not quite an off-the-shelf product. What social solutions does is it actually visits different programs and works with the staff to create a tool or a model that works for the program. And this comes at a cost, so it's not quite as affordable. But like the FAST software, it saves frontline staff time, it's easy for reporting, and it also tracks client progress. But other specific assessments, like the FAST software, because the FAST software has an assessment built into it, you can find assessments at the California Evidence-Based Clearinghouse, and that link is right here at the bottom. So in conclusion, so these are just some methods and practice for a strengths-based model. Are there any questions? Looks like there aren't any questions at this time. Some questions are being formulated. Yes, you will have access to these slides after the webinar. I have a question about that. Looks like I might have missed one of a good question before we responded to the prior one. So since there aren't questions, you want
Kaya.
Yes.
Kaya, the question was, can you give more specific training ideas that can help address the challenges you discussed?
Sure. So in terms of, let's go back to maybe some of, is there anything in specific with the practices or? All right, and I saw another question, but so is there a specific, something specific to the training, something specific about the training, implementing the training? Was there a specific slide that you wanted to talk about?
Chelsea Thomas, I'm going to unmute you so you can ask your question out loud.
That'd be great. Sorry, thank you.
Oh, Chelsea, except you have yourself muted on your end. There you go.
Hi there.
Hi.
Hi, yeah, I was just wondering if you could maybe speak a little bit more to this whole idea of trainings. It seemed like for many of the challenges that you addressed, one of the main solutions was training, and I'm just wondering kind of, what does that training really look like, specifically around culture and turnover, what sorts of trainings are, most beneficial, most effective?
Yeah, so what I find with base model training is role plays are usually the most effective. Now, unfortunately, in webinars like this, role plays are a little bit more difficult to do. And so actually I sped through some of the exercises, but I find that role plays are the most effective. A lot of caseworkers like to see specifically their supervisors act out role plays of how the strengths-based model is approached with caseworkers. And it's something that I have trained on in the past. So yeah, I would say role plays and having the supervisors really be involved in those role plays so that they can see what their supervisors are doing. Another thing is having trainings either recorded, having videos, having trainings like this also recorded, sharing them with caseworkers. I find that 30 to an hour training videos are really useful. Again, and something I mentioned is supervisors should train themselves on these different models, and then I find that about once every 2-3 months, having open trainings and inviting your staff to attend as needed. But yeah, so those are some role plays. Making sure that you have training videos on hand that you can share with your staff. Those are some different ways of recurring training. And I saw another question about first five.
Right. Did you address that question yet regarding the software examples?
I didn't actually. What was the question? I'm sorry.
Let me unmute Michael and he can ask his question out loud.
Great.
Hold on. Michael, are you there? Well, Michael is not there, but his question, Kaya, was regarding the software examples. How have those lent themselves to meeting requirements of first five and protective factors? And are they pretty customizable in terms of reporting requirements?
So yes, actually the FAF has a crosswalk for protective factors, so it does comply. And also, actually the FAF was used under LA County PFS, Partnership for Families, that works and uses the protective factors model. It's also used by Family Preservation that also uses the protective factors model. So that one already, again, is integrated into the system. Social Solutions, you can actually develop questions or you can integrate assessments into the tool. And so that's one way of meeting first five requirements. And hopefully that answers that question.
Kaya, do you know the website for Social Solutions?
I do not know it offhand, but I have my contact information on the last slide, which will be shared, and I'm happy to send that over.
Okay, great.
But I do. And the FAF software website is just myfaf.org, myfaf.org. And you can also learn more about the FAF and how the strengths-based model is integrated there.
Were there any other questions?
problem, Michael.
So you can all see Kaya's contact information, and as was mentioned, the PowerPoint presentation will be available to you following the presentation. We will send that out to all of you. So on behalf of Strategies 2.0, we would love to thank Kaya for her presentation today. I want to thank all of you for your participation in today's webinar. An evaluation will be sent to you automatically. As Shane mentioned, we invite you to go on to www.strategiesca.org. There is a lot of information about trainings that Strategies can provide to your agency free of charge. We do have a case management training. We have a very good culturally proficient professional training, and a variety of other trainings that we would love to bring to you and to your organization. It will also give you information on future webinars that are coming up. We have another webinar coming up in 1 week from today on working with parents, and a whole series of webinars coming next year. So we invite you to go onto our website and see what we have going on. Thank you so much. Just one more chance if there's any other last questions out there for Kaya before we sign off. I know sometimes it takes a moment to think about these things.
It sure does.
We're getting a lot of thank yous, which is very nice.
Yes, thank you all so much.
Okay, so on behalf of Strategies 2.0, we want to thank Kaya and all of you for participating today.
Thank you and take care.